Okay, let's start off. So today's webinar is all about the crucial role that sample integrity plays. Um, and we have to understand that every report that comes onto um, the paper, the value that is on the paper should be the value which is there in the patient's body. So, our utmost importance is to be given to sample integrity. Now, if the sample integrity is lost, the value is totally wrong. It is not the value in the patient's body. And once it is deteriorated, like it's like I keep referring to cooking. If the dish is spoiled, would we be able to eat it? It has, the purpose is lost. So having a sample which is very, 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 very on par, the ingredients, the constituents in the sample should be on par exactly how it is in the body. When that happens, then the value on that report will be exactly how it was at that point of time when the sample is taken. So that is what everybody, all of us should understand, that we've all been concentrating on equipment, QC, calibration, but we've realized that a percentage of errors happen at that point. The major percentage, 65% of the errors happen here. And none of us are actually concentrating on this area. We might say, okay, once a sample comes to us, we are doing a good job. No, our responsibility is right from the time the doctor thinks about ordering the test, because we should educate them onto what are the latest tests that are there, what is the sensitivity, what is the specificity, when do you collect the sample, what is the time of collection, what is the patient preparation, how the sample has to be collected, which container it has to be collected. It is our duty, it is our role to tell them how it has to be collected. And that is the crucial role that we need to play. If we say, okay, we put a sample, the value came in, it's garbage in, garbage out. No, we all have to now concentrate on the pre-analytical phase, which is 65% of the times the report is wrong. And all of us, we think it's not our area. It is our area. And that is why in 15189 2022, POCT is also come in. And I wish it becomes that every doctor undergoes training in how to order tests, when to order tests, what instructions to give the patients, because patient preparation is very important, sample collection is very important, be it for anything, be it for microbiology, pathology, biochemistry, anywhere. When we collect, how we collect is very, very important. Now, first of all, hi everyone. Thank you for taking the time to join me today. And I wanted to have this conversation with all of you about something that is incredibly important to our work and more importantly to the patients who depend on us. I wanted to put up this slide because we all became doctors to treat patients. And somewhere along the line, we are not dealing with patients directly, but indirectly, and that connection is gone. What it actually, when you go to a patient, when you talk to a patient, when you see the patient, when you feel he's sick. So it's very, very important that we understand what it is all about. So the introduction to sample collection, what everyone needs to know, the crucial role of sample integrity, And I'm Dr. Shailaja, and today is August 20th. Importance: accurate medical diagnosis and effective patient care. Read this: accurate medical diagnosis, effective patient care rely heavily on the quality of the collected sample. On the collected sample, the quality of the collected sample. I'm emphasizing the quality of the collected sample. From blood to urine to tissue samples, each specimen must be obtained using standardized protocols. What do I mean by standardized protocols? SOP. Some SOP, somebody written, not relevant to us. No, they are some standard guidelines. We have to draw the sample, blood sample in and collect. When you're collecting multiple samples, we have to follow the order of draw. That standardized protocol of order of draw is standardized protocol. And to ensure why we have to do it in that order. Why blood culture first? After that, what? After that, what? Because that will ensure sample integrity and reliability of test results. So this webinar will explore the critical step involved in proper sample collection, the role of all of us, all the healthcare providers, the consequences of not collecting properly, and by the end, all of us will have a comprehensive understanding of the best practices to uphold diagnostic accuracy and deliver highest level of patient-centric care. Now, what are the types of samples and patient preparation? Everybody, when we talk, they only talk about blood. No. We have urine, we have stool, we have saliva, we have tissue biopsies. And each type of it requires specific handling and collection protocols. And to maintain that integrity and prevent contamination When I mean contamination, what is not there is introduced, what is there is lost. Either way, the integrity of the sample is lost. And what we have to start with is patient preparation. We have to understand, all of us have to go and put down our foot and say, patient preparation is crucial. If this patient is not prepared properly, please do not collect the sample. Ask them to come another day. Tell them, sir, your value will be wrong. Please come another day because we want to give your values correctly. And how do we ensure patient is prepared properly? We need to educate the doctors. Our youngsters, our interns and all, they have no clue. So we have to give them a list of what all samples need fasting. And when we mean fasting, we assume they all know it's 12 hours fasting. No. In India and many of the places, we eat 10 o'clock. And when we eat at 10 o'clock our dinner, at 7 o'clock they come to give our sample. Where is the question of 12 hours fasting? And then you find triglycerides are high, glucose is high, they land up with medication and the adjustments become a problem. So get down, tell them, write it down, give it to them. 12 hours fasting means previous evening by 7 o'clock, complete your dinner. Then come and give it at 7 o'clock. That is fasting. Proper patient preparation. If you're taking therapeutic drug levels, whether it is peak level or trough level, depending on the half-lives, half an hour before the tablet is taken. Now he says, madam, I'm taking the tablet at 8 o'clock in the evening. Come at 7:30 in the evening and give your sample. If you go to a theater and the theater, the movie is starting at 8 o'clock and can they go and say, please start it at 6 o'clock? No. So patient preparation, patient sample timing is very, very important. How many of y'all today felt, yes, it is very important? Go on, type out in the chat box. Today, what I'm saying is something that was not reflected before, that it can change the value. We took it for granted. Go ahead. assume doctors know everything. They will tell that the 12 hours fasting. So we don't go ahead and we don't ask our thing. Absolutely. We don't ask the patients, are they 12 hours fasting? We assume that the patients are 12 hours fasting. No. Let's first think first. Let us stop assuming that people know. Today, note down in your pen. Stop assuming that people know. If they know, it will be a reiteration for them. If they don't know, they've learned something and then they're following the right path. So, first and foremost, tip today is stop assuming that people know. Be it doctors, be it phlebotomists, be it anybody. Stop assuming that they know. Let them know this is the way the sample. Cortisol, only at 8 o'clock in the morning and only at 4 o'clock we have the biological reference intervals. If you take it, we don't have reference intervals. We don't know what to compare with. Urine midstream sample. If we do not give them instruction of how to collect, 100% it will be wrong. If the patient is menstruating, of course, and you've not taken the history, you've not told her, there will be RBC, and unnecessarily they will take it as UTI. So there's so many instances where patient should come prepared. Then aseptic techniques, especially blood culture. I have seen numerous amount of times. I mean, we have our skin microorganisms, then we use a toilet, we are in the hospital, we touch that, we touch this. And of course, on the patient's body, it will all be there. And if we do not use aseptic techniques, the blood culture grows something which is not in the patient's body. And we are going on assuming, where is this coming from? And imagine if he's on the ventilator, we think, okay, it's VAP, it's a central line, it's a corti, it's a catheter. No, actually, he didn't have anything. And if you see, the WBC count is not increased. So that is about adherence to protocol and ensuring that skin disinfection is mandatory.